Hello, everyone. Today I'll be presenting my project, which focuses on the investigation of left ventricular assist device inflow and outflow cannulation in heart failure patients. Cardiovascular disease is the leading cause of death in the United States, with approximately one person dying every 37 seconds. The lives of many end-stage heart failure patients can be improved through the implantation of LVADs, or left ventricular assist devices. The two types of procedures in which a patient receives an LVAD are bridge to transplant, in which a patient will temporarily use an LVAD until receiving a heart, and destination therapy, in which the patient's last option is the LVAD and they will not be receiving a heart. Currently, there are 6.5 million heart failure patients, of which 10% are living with LVADs. Worldwide, there are about 100,000 new eligible patients, 60% of which are in the US, and the numbers are consistently increasing. While LVADs are greatly beneficial for patients suffering from cardiovascular disease and heart failure, they also come with several risks. In one study, it was found that approximately 36.2% of patients experienced gastrointestinal bleeding due to LVAD implantation. Additionally, in other studies, it was found that the incidence of stroke after LVAD implantation ranges from 12.1% to 28.7%. 12.1% being the minimum risk of stroke, regardless of the pump type a patient receives. Despite the risks that are associated with LVADs, research has shown that these medical complications do not arise solely from the LVAD design, but they can also be due to LVAD implantation procedures. Some of the main components of an LVAD are the pump itself, the outflow graft, and the outflow graft anastomosis, and all of these are labeled within this diagram. Researchers have also found that factors such as the outflow graft angle and the anastomosis diameter, also shown here, as well as similar features around the pump itself, may influence risk of stroke and other negative outcomes. The main goal of this research is to shed light on safer LVAD implantation techniques to improve the lives of future LVAD patients. We aim to accomplish this by completing measurements of CT scans using 3D slicer and later determining correlations between these measurements and stroke rate. Additionally, we aim to perform computational flow dynamic analysis to determine if there are changes in blood flow after receiving an LVAD implantation. Now, to give a more in-depth overview of our methodology and speak about the softwares that we used. Over the past semester, we received CT scans of patients who had recently received LVADs from Houston Methodist, and these were uploaded onto 3D Slicer. 3D Slicer is an open source software platform for medical image informatics, image processing, and three-dimensional visualization. This software was used to perform measurements and create 3D models. Other softwares that were used to clean up and prep the 3D models for future use in computational fluid dynamic simulations were Blender and SolidWorks. Now to go into our methodology, each CT scan was measured a total of 3 different times over the spring semester. These measurements were used to statistically analyze if there is a correlation between stroke and LVAD implantation. Over the course of the summer, these CT scans were used to create 3D models of the aorta and outflow graft. 3D Slicer was used to create the main model. Blender was used to reduce the number of faces on the model so that it could be uploaded to SolidWorks, and SolidWorks allowed us to clean up the edges of the model and make sure that each face was flat. The next 3 slides show some of the length and angle measurements we took and examples of the 3D models. These are some of the lengths that we measured: the distance between all of the annuli and the sinuses, the distance from the aortic valve center to the center at the graft, the inflow length, and the anastomosis diameter. These are some of the angles that we measured: the outflow minor angle, the outflow major angle, and the inflow angle between the pump and the mitral valve. And finally, these are some pictures of our 3D models. These were all created through 3D Slicer, and the green parts of the models are the aorta, and the orange and purple parts of both models are the outflow graft. The location where the aorta and the outflow graft meet is called the anastomosis site. In the future, we will be also looking at the angle at which these 2 parts meet. Another thing that you can see here is in the top left and the bottom left, the CT scans have highlighted green and orange areas, and these are what we selected in order to create these 3D models. After all of the 3D models are created, we will be using ANSYS and its fluid flow solver to perform tests. We will assume any simulation blood is incompressible and Newtonian, and flow will be treated as laminar. This basically means that the flow will be treated as if it is not turbulent. For the testing, 7 cardiac cycles of tests, so essentially 7 heartbeats, will be run, with the last cycle being used to complete analysis. This is done in order for us to reach a steady state, and this allows the analysis to be reliable. In the analysis, we will assess the flow shear that the simulated platelets experience, and we will track the particles and estimate their platelet activation potential levels and trajectories. The figure below shows the ANSYS and fluid flow solver example and how we aim to analyze our data, and the graph is an example of what the data will output. So far for results, from our measurements from the spring, we have found that there is a strong correlation between stroke and inflow depth and stroke and major outflow angle. The pictures below show the measurements that we took. While we haven't gotten results to analyze from the computational flow dynamics just yet, some expected results are that the highest amount of shear will occur close to the anastomosis site, so where the outflow and the aorta meet, and that the angle of the anastomosis site will have an effect on the flow shear. The flow shear is associated with an effect on thrombosis and stroke. Overall, LVADs are medical devices intended to help prolong the lifespans of patients with heart failure. We hypothesized that complications such as stroke were associated with how LVAD inflow and outflow cannulas are implanted in patients' left ventricles and aortas, respectively. Upon performing statistical tests, it was determined that the association between the inflow depth and stroke, as well as the major outflow angle in stroke, were statistically significant, meaning that the p-value was less than 0.05. The pictures of the measurements for the inflow depth and the major outflow angle were shown previously. In the future, we plan to continue performing measurements on CT scans to increase our power to a minimum of 80%. Over the spring semester, we received approximately 100 CT scans, and we completed measurements for all of those. However, we plan to double our sample size and bring it up to 200. We also plan to complete as many 3D slicer segmentations to enable computational flow dynamics simulations. These tests will allow us to determine if there is any difference in the flow of blood after receiving LVAD implantations and determine the effects of possible altered flow conditions. From there, we can determine if there are any necessary changes to be made to the implantation procedure of LVADs. This is a picture of our references that we used. And I just wanted to say a quick thank you to the BMEL lab, the HMRH team, and all of our funding. Thanks, and Gagam.